What's up, good people? Thank you so much for checking back on my channel and giving me the good feedback and giving me likes and subscribes and shares. And again, this video and all of my videos are for educational purposes only, and please spread the education and the awareness amongst your people. I have a friend of mine today to introduce to you people. He is called Newton and he's sitting right here. But the thing is, he's not really happy today. Why is he not happy? It's because he has been having headaches for a while and he thinks it's a migraine headache. But I beg to differ. I beg to disagree with him, and because I think it's not a migraine headache, it is a headache, but in my diagnostic potentials, I think it's a cluster headache. Why did I call it a cluster headache? Why did this friend of mine get cluster headache? Number one and very important thing in cluster headache is it tends to happen in males. Males are more profound to get this kind of headache called cluster headache. There is a 5-to-1 ratio. So males are 5 times more likely to get this kind of headache called cluster headache compared to females. That's one leading point towards that. Secondly, it's a unilateral headache. He comes with a headache right in his eye. He thinks his eye is hurting, or he thinks right above this eye, or in other people it could be other area, but he thinks right above this eye it hurts really bad. Or sometimes he thinks right in this temple or one of the temples of the localized area in this kind of distribution of the face, it hurts really bad. So that again leads me towards the diagnosis of cluster headache. And because this headache has a certain pattern and certain distribution and certain frequency of attacks, that leads me towards the diagnosis of cluster headache in my friend Newton. What is that pattern? What is that frequency that will guide you towards the diagnosis of cluster headache? Let's talk about this. So a very important thing about cluster headache is that it happens in episodes, and episodes are usually less than an hour long. But the prescribed or the research-based time frame for the headache is it lasts from 15 minutes to 118 minutes. Anytime between this kind of range of time period could fit into a cluster headache, and it can happen once in every other day, or it can happen up to 8 times a day. Imagine one episode lasting like 1 hour or up to 180 minutes, and you can have up to 8 episodes in one day. That's why Newton is not happy for a while, because this headache does not just happen today and then it's gone. No, it has its patterns and it has its frequencies, as I mentioned, and the frequencies and the patterns can last from days to weeks to months. That's why sometimes it's also called as a seasonal headache, because if you have, let's say in summer, you have few weeks or few months and you had that specific pattern of headache where your eye is hurting and your area above the eye is hurting, or one of the temples is hurting, and you are having that kind of time framing in that kind of headache, then it's a cluster headache. And again, it is, or it sometimes is, seasonal headache, because it comes for a certain season and then it may not come again, or it might come again in the same season. And therefore you need to diagnose it really carefully, and do not label every headache as a migraine headache, because that's somehow been a trend lately that people think every headache is like a migraine headache. Oh no, I'm having migraine headache. No, this Newton friend of mine does not have migraine headache. It's a cluster headache. Why did I call cluster headache? Because not only those patterns that I just mentioned are matching into Newton, also the distribution is usually in this area. We call it a trigeminal nerve, the first branch, which is right here. So it is matching that distribution. Secondly, when he gets those attacks, they are so severe that he feels like it's hurting in the eye, and he literally feel like taking his eye out, which is very pathognomonic of cluster headache. And the eye starts to water, the ear starts to, the nose starts to run, and it's like rhinorrhea and lacrimation going on in the same area, in the same side, and he gets really congested. He gets really, really congested, and this eye, or the eye that is involved in this kind of headache, is red. You have a congested conj in that case, or conjunctiva. In clinic we call it conj just for short, but it's a conjunctiva, which is the white part of your eye here. And in addition to that, it has also been found out that you do get some sort of swelling, or the facial swelling in this or particular region wherever it is happening. And sometimes if you try to self-evaluate yourself, which is very possible, you can look into the mirror and make sure the light is not too bright, and try to compare the size of the pupil. The size of the pupil between the two eyes, you will notice, or you can just take your picture, you will notice that one pupil on the affected side is smaller than the other one, and that is another very, very good sign that you can notice in this kind of cluster headache. So this Newton friend of mine was having ptosis. Ptosis is like, this upper lid will be drooping down. And he also had, small pupil on this side, the side that was hurting, the side he really wanted to get rid of and take the eye out of it, But we don't want the patient to end up in that kind of scenario. So please make sure you or your educator or your physician, whoever is diagnosing your headache, you can guide him towards the symptoms that you are getting, so that you are not labeled as a migraine patient. Rather, you are diagnosed correctly so that you are treated absolutely correctly. That's my purpose of this video. Please like, subscribe, and share this video, and ask me questions if you have any. Thank you so much. Have a great day. Bye.